Alright, so today we're going to be covering a specific topic called scapular winging. It's something that's kind of thrown around. It's also referred as scapular dyskinesis. We're going to kind of go into what's the mechanism of action that it's caused by, what the pathology can lead to, and then what it is primarily caused by in terms of its mechanical dysfunction in the body. So kind of some of the topics and questions we're going to go over is, what is scapular winging? What causes it? What are some of the issues that you can see with scapular winging? How can rehab reverse the severity of scapular winging, and how can you prevent scapular winging in the future? So let's kind of go over just briefly what it is. I'm sure if you Googled it by now, or if you have this, you kind of know already, but for those of you who don't know what it is a dysfunction involving the primary muscles that stabilize the scapula. Now, this instability of the scapula results in imbalances and abnormal motion of the scapula. So here we have a picture. We can kind of see that the left one on this individual is winging. So what are some of the basic causes? So it's pretty much either muscle weakness or imbalance, or it can be damaged so it's muscle weakness or imbalance, or it can be damaged or impaired innervation. And sometimes it's caused by instability of the muscles surrounding it. So now we're going to kind of go into just some brief anatomy so you can kind of get a visual of what's kind of going on here. So we have the primary stabilizers of the scapula, or what we can show you here is the serratus anterior, the trapezius, the rhomboids, and the levator scapula. So here we have the trap, here we have the rhomboid major and minor, here we have the levator scap, and then here we have the serratus anterior on both sides. So which muscle often causes scapular winging? Most of the time it's due to a weak or inhibited serratus anterior, as well as an overpowered trapezius. So we can kind of see some of the actions of the serratus anterior. So it draws the scapula anterolaterally. It suspends the scapula on the thoracic wall, and it rotates the scapula. And it originates from the ribs 1 through 8, or sometimes 9, as well as the intercostal fascia. It inserts on the superior angle of the scapula, the medial border, and an inferior angle of the scapula. And it's also innervated by the long thoracic nerve, which is C5 to C7. This is important to note for later. So there's a couple different types of scapular winging. There's the medial scapular winging, which usually results in a dysfunction of the serratus anterior muscle we covered previously. And it's caused usually by an excessive medializing scapular retraction and elevation. And it tends to occur in younger individual athletes. Some of those pull and push individuals, whether it's wrestling, football, swimming, just any of those push-pull individuals that tend to have it, more commonly noticeable than other sports. And it's more common than lateral scapular winging. Now, lateral scapular winging is usually a dysfunction of the trapezius or cranial nerve 11, which is spinal accessory nerve. It's caused by weak superior and medializing force on the scapula, excessive lateralizing scapular protraction, so serratus anterior, pectoralis major, and minor. And there's an overlap in risk profiles in individuals with a previous history of neck surgery. So that's why we mentioned that spinal accessory nerve, or the long thoracic nerve in that case, which was C5 to C7 from where it originates. So here we kind of got a picture of showing you, trying to find both. I try to find a picture that shows you both the scapular winging, so forgive me if it's a little pixelated. So we have medial, you can kind of see which the normal, so it'd be kind of coming in here, which we know that is weakness due to serratus anterior. And then lateral, which is weakness due to trapezius. So some of the increased risks associated with scapular winging can be anything from pain, decreased strength, loss of normal range of motion, adhesive capsulitis, kind of when the shoulder gets stuck, so they call that frozen shoulder, subacromial impingement, brachial plexus radiculitis. So what are the therapies available for scapular winging? The good side of this pathology is that it is treatable with conservative care, meaning you can use physical therapy, strengthening exercise, range of motion exercises, manual therapy, electrical stimulation, something as taping, or even something that most practitioners will do called neuromuscular re-education. So kind of going into each portion of the modalities, we're going to break down what they can do, and I'll give you some exercises and kind of everything you can do for scapular winging. So with physical therapy, there's usually a dynamic movement specialist, such as a physical therapist or chiropractor. They'll tend to evaluate your condition. Now, after assessing, they'll identify if the impairment is muscle weakness or neurological in origin. Now, this is where it's important to give your practitioner a good history on what's going on, if you had a previous neck surgery, whether it was you were a child or whether you were older or whether it was recent, just because it can happen in later years, as we've seen, and people had a neck surgery from a car crash when they were younger. So this will help the physician identify any imbalances, weakness, or abnormal movement patterns that may contribute to your condition. The benefit of physical therapy is that it offers individualized therapy treatment plans. So the physician will design a patient-specific protocol that is based on their findings during the physical exam. These protocols will usually involve an array of personalized treatments that are specific to you, some of which tend to include exercises, manual therapy, and other treatment modalities depending on the physician's field of practice or specialty. So if it's a physical therapist, they'll do rehab exercises, rehab mobility, range of motion. If it's a chiropractor, they'll do some manipulation, some soft tissue work, give you some exercises, kind of go into your dietary things and some neurological testing to see if there's anything else contributing to these factors that allow for the inhibition of the muscles that may cause medial or lateral scapular winging. So they'll also focus on correcting muscle imbalances. As we now understand that scapular winging may be a result of muscle imbalances, the physician will work with you to correct any muscle groups that are under or overdeveloped. There will usually be a combination of strengthening weak muscle groups, such as the serratus anterior, and stretching tight ones that may be inhibiting range of motion, such as the pec minor or major. Some of the other modalities that they have are range of motion exercises. They'll do dynamic stretching, and range of motion exercise techniques are often applied to these individuals with scapular winging. This is performed in order to maintain mobility, flexibility, and agility of the shoulder girdle. If you can't maintain mobility, flexibility, and agility, and even stability in this case, you're going to be prone to a lot more injuries that could not affect you today but later down the road. So it's something to get taken care of right away. Get a physician to take a look at it, make sure that you're going through the proper strength training exercises, and even do the strength training exercises that allow you to protect your shoulder and not allow this pathology to develop in the future. So some other things that they'll offer is dynamic stretching and range of motion exercises. So something to note as well is that the glenohumeral joint is ranked as the most mobile joint in the human body. If there's loss of mobility, flexibility, and agility, and even stability in this case, the results will negatively affect an individual's daily life. Now going into something that everyone enjoys or doesn't enjoy depending on where it's done is manual therapy. So some of these techniques can include soft tissue mobilization, which apply stretching and deep pressure to decrease the rigidity of muscle tissue. It helps relax the muscle tension. It can also help move inflammatory fluids that may be isolated in these tissues. Now, another thing they may do is joint mobilization, which applies manual therapy techniques in order to help modulate pain and treat joint dysfunction that tend to limit the range of motion. And these techniques tend to address specific mechanics of that particular joint. Now, the other one that some practitioners may offer, depending on their field of practice, is something called a myofascial release technique. It's a therapeutic technique that's aimed to relieve pain in thick connective tissue. So the fascia is just connective tissue. So some of the common exercises that we can kind of see that are offered if you look online, and I kind of pick the ones that I tend to favor more as they're more dynamic and more involved in more muscle groups. So these are push-ups. Another variation would be knee push-ups plus is what they call them. Scapular push-ups, abdominal wheel rollouts, and then dumbbell pullovers. Let's kind of go over the first one. So push-ups or knee push-ups plus. So push-ups just tend to be one of those underrated exercises that tend to have a high activation of serratus anterior, depending on how you do them. So we kind of see the muscles going on here. Not only most people associated with the pecs and kind of the anterior delts as well as the triceps, but also does involve the serratus anterior. To do the movement, you have to stabilize your scap and activate the serratus anterior. Now, I looked online and I saw a couple different variations that I found very useful, which they're called the knee push-up plus. So here we have an individual that's doing them on a chair on an incline. So if you do have scapular winging, I recommend that you start with B, kind of going in with this dynamic movement. And kind of the studies have showed that there is higher muscle activation on knee push-ups and even more activation on knee push-ups done on an unstable surface when compared to a regular push-ups. So I would progress from B to A, then D to C. And you can kind of see that stability work, moving and stabilizing as you're going into the actual movement, forces you to contract and use the serratus anterior more. When we go over dumbbell pullovers, I'll kind of tell you something from personal experience as well. So this is a stabilizing muscle. Now, some other push-up variations that are a little more, I guess, difficult, but are really great are called, so something that's another variation that I've kind of come up with are banded push-up variations. And these are a little more difficult, but they have higher muscle activation. They're easier on the joints and stress more the musculature, and it trains the muscles to be more explosive and favor stability. So pretty much you just put the band behind your back, kind of push it on your hands, and then do the push-up there that way. You'll notice that the benefit of doing these banded workouts is that most of the time where people get hurt or tear a pec is usually at the bottom of the arc and as they're coming up. No one really tears a pec as they're coming down. It's usually when they're kind of jolting it up, and that's when they tear it. The benefit of this is that as the band is down here, it's a lot lighter and easier on the muscle and easier on the joint where it's most mechanically weak. As you come up, it gets heavier and heavier and heavier and heavier, and eventually causing the muscle to activate more where the joint is the strongest and where the muscle is the strongest. Kind of prevents injury along the way. So now we have a different variation called scapular push-ups. So this variation of push-ups helps target the serratus anterior more than the other muscles involved in a normal push-up, and it shows to help increase shoulder mobility and stability in individuals with scapular winging. So pretty much you just kind of get on a push-up, and then you kind of see that this individual is arching their back, pushing forward and coming down, pushing forward and coming down. So you can kind of see up, down, and so that's just forcing the scap to kind of activate there, or the serratus anterior to activate in that location. Now another one that's very underrated that I would say is the abdominal rollouts. It's a great and effective exercise for targeting all abdominal regions depending on the orientation of movement. So I kind of showed you an individual here is kind of doing the obliques to left and right laterally. It involves most stabilizers of the abdominal region, spine, and shoulder region. So just to perform this, you have to be able to stabilize in a lot of different locations. So it's a great abdominal workout that includes the stability of the serratus anterior. Now, this is one that most bodybuilders are familiar with, and my only gripe with this is one thing on the technique. It's a great exercise. It activates the muscles in the chest, back, and targets the serratus anterior. It would be great for a bridge exercise to add between back and chest exercises. And as I mentioned previously, as a stabilizer, if you do this between your back and chest, you'll notice that when you're doing chest, you're not as strong in a good way because you already shot out the stabilizer. So you're going to be targeting more of the chest muscles and more of the other stabilizers that you didn't really use before. So an example would be doing lat pull downs, rows, dumbbell pullovers, and then doing incline bench, flat bench, and then decline bench. So as I said before, my only gripe with performing this is most people tend to do it like this, and I really wouldn't recommend it. And kind of a story is that you can Google this individual. Her name is Mary Ellen, and she's a very big stickler for putting dumbbells on her benches. She'll get real pissed at you. But she's a bodybuilder Hall of Fame individual, knows workout techniques better than most individuals on this planet, I would say. And she showed me this variation, which I found very helpful in not only allowing me to get the dumbbell where I needed it to be, but it allowed for my scapula and my shoulders to be in a more beneficial range of motion and have more stability than getting hurt. So we can kind of see this person here as they're coming down for the pullover, right? They're gonna be putting their shoulders in a very dangerous place where they can get hurt. If you do it with the actual bench though, behind you in this parallel motion versus being perpendicular, you can kind of see that their shoulders and even their neck is even more stabilized. And then all you pretty much do is you kind of just sit up with it, put it on your chest or on your lap. So you kind of just sit down, lean back, and kind of go over it that way. I favor this variation a lot more than this one. It's a lot easier on your shoulders. So that's my only gripe with this movement, is that if you Google it, most variations will be like this. Very few variations will be like this. Now, another one that's really good for serratus anterior would be the banded pullover variation. So during COVID, we got our bands, and the whole lockdown, bands became liquid gold for exercising. So you can kind of see that this variation is good for stability, agility, and explosive work. It forces stability of all other upper body muscles and even leg muscles prior to even performing the exercise. You can kind of see doing those pullovers that way, that it's easier at the top and heavier at the bottom. It forces more of that stability work. So that's all that I have for you today, and then I kind of attached some of the sources at the end here so you guys can take a look at where I got some of these articles, where I got the information from, and some just great sources you can find and do your own reading on the literature of what it is that scapular winging may cause. I hope this video was beneficial and helpful in aiding you and guiding you in the direction of what to do and what to see, whether it's a physical therapist or a chiropractor, kind of help you get this very treatable pathology taken care of. And it's something that'll allow you to just live your daily lives better. And if you found this helpful and informative, I would appreciate you to like, comment, share, and subscribe, as it is the best way to support our channels. Thank you and have a wonderful day.